Now to an update on the growing cyclosporiasis cases here in Indiana. At last count, nearly 1,100 cases, 56% of the patients diagnosed with this, female, 44% male. And the U.S. right now is facing its largest cyclospora outbreak to date, with 45 states now at least reporting one case ever since they were tracking this starting in May.
Health officials are now racing to trace the details of cases in an ongoing investigation. Lee Waldman explains why this parasite is so hard to find.
Cyclospora is really unique. We have to remember that it is a single-celled protozoan parasite. It's not a bacterium. So cyclospora is really different, basically in terms of all biology, from Salmonella or E. coli.
What makes cyclospora so unique is part of what makes it so difficult for food safety experts like Dr. Kalmia Neal and Dr. Craig Hedberg to trace. Labs can test and grow bacterial pathogens, but with a parasite like cyclospora, they're limited to whatever samples they have.
We just don't have the ability to say that this group of 5 cyclospora cases are all related, and they're different from this group of 10 cyclospora cases.
There's an ongoing investigation into a large multi-state outbreak centered in the Midwest. Unfortunately, bacteria or cyclospora contamination can't be seen by the naked eye, so it takes an outbreak to identify a problem.
Unfortunately, the more cases that occur, sort of the better our ability to work through those systems and find some of those common threads.
While the current cyclospora outbreak is making headlines, other pathogens in food like E. coli, Salmonella, and Listeria have led to outbreaks in the past. This shows why protocols in place to protect our global food supply are so critical, yet challenging.
Training is really critical when it comes to worker health and hygiene, and making sure that people understand the why.
In New York, I'm Lee Waldman.